Name 30 symptoms of celiac disease that have nothing to do with the gut. I'll go first. Brain fog, headaches, skin rashes, fatigue or tiredness, joint pain and swelling, weight loss, infertility, recurrent miscarriages, gum disease, bad breath, oral ulcers or ulcers on the tongue, swollen gums, decrease in tooth enamel, breast pain, heavy periods and painful periods, leg cramps and muscle spasms, swelling in the hands and feet, vitamin deficiencies, and then these can ultimately secondarily lead to even more symptoms: ADD, anxiety, depression, memory loss, mood swings, brittle nails, acne, easy bruising, burning scalp, dark circles under the eyes, eczema, hives, and now I realize I did say skin rashes at the beginning, but there are so many different skin rashes that it can cause, I thought it would be good to name at least a few of them, hair loss, seizures, decreased bone density, decreased blood sugar, irregular heartbeats and heart races. Another skin rash, the classic one, is dermatitis herpetiformis, and there are still so many more that I haven't even mentioned here. Now, as a rheumatologist, why do I care? Well, I care for many reasons. Number one is that patients with celiac disease are at a higher risk of other autoimmune diseases as well. So sometimes we see patients in my clinic who have celiac disease plus another condition that I need to see them for, such as rheumatoid arthritis. The other thing is that the symptoms of celiac disease can sometimes mimic other conditions that I would see as a rheumatologist. For example, the inflammatory arthritis that some patients get with celiac disease can look sometimes like rheumatoid arthritis. And it's important to differentiate the two because the treatments are different. Obviously for celiac disease, the treatment is a strictly gluten-free diet, whereas rheumatoid arthritis, the treatment is different. Now I will just preface that by saying that some patients with rheumatoid arthritis do notice a benefit when they go gluten-free, so I shouldn't just say that no one with rheumatoid arthritis should go gluten-free, but it is just different pathology. The other thing is that if patients have two autoimmune conditions, they have the celiac disease plus rheumatoid arthritis, for example, if they're not gluten-free and their joints are not doing well, it's hard to know what is actually driving the symptoms. Is it their untreated celiac or is it the rheumatoid arthritis? So getting the celiac disease treated and under control is really helpful because then you know what's left. As well, undiagnosed celiac disease is actually quite common, and if you have undiagnosed celiac disease, it can actually be quite damaging for you and put you at a higher risk of getting cancer. So it's important to recognize. The other thing is that I've seen celiac disease do other things that can look like other rheumatologic conditions as well. For example, I've seen it cause something called livedo reticularis, which is this type of kind of lacy skin rash that we can see also in other conditions like vasculitis or lupus that I treat. But again, the treatment for celiac would be very different than the treatment for lupus, so good to recognize the difference between the two.